HPV, everybody knows about that because of the famous actor who got throat cancer because possibility of having HPV. And it is true in the journals, over 31% of head and neck cancers are caused by HPV, the human papillomavirus. And then if you happen to take the vaccine that they are giving girls and they want to give to boys, you can also get it like that. A vaccine can cause the problem itself. Now, hepatitis B, C, herpes, they all put a damper on the immune system, not allowing your body to take care of itself. They create inflammation. So if we keep our body in ideal homeostasis, we will not grow these organisms. Biological factors. Lots of people have already talked about. You are what you think, breathe, drink, and eat, and how you move. So there is no escaping, and I tell all my patients, and I have a lovely group of incredible patients here today, and I tell them, I'm just a messenger. You have to eat food that will nourish, strengthen, heal, and turn on the mechanisms of your body. You can't eat dead food or you're going to be dead. That is just the way it is. You have to eat foods that have been untouched by man and kissed by the sun. Toxic emotions. Dr. McDonald will coming up next. But I want to touch upon this because I've been practicing for going on 29, 30 years. And the biggest thing that I have learned in my practice of medicine is that you have to rid yourself of toxic emotions. All illnesses have a toxic emotions, even a cold. Dr. Hammer, very famous German physician who got testicular cancer years and years ago. He was an oncologist in a hospital in Germany. He got cancer. He started asking his patients, well, why do you think I have cancer? And why do you think I have cancer? And all of them began to tell him that they suffered from a traumatic experience. And so please look him up. He wrote the 5 Biological Laws of Medicine, and I think he should have gotten a Nobel Prize for it. Thyroid, I already talked about it. Your thyroid's the battery of your body. It has to work because it's turning on every cell in your body. Intestinal toxicity. Your intestines, half of your immune system or more, if you're over 60, is housed in the intestinal, which consists of your mouth all the way down to your lower intestines. Hormone therapies. If you take birth control pills and synthetic estrogens, they turn on the body in an unfavorable way. Block detoxification. If you have a scar, if you have calluses, they create interference fields. All those things have to be taken care of. Cellular oxygen deficiency. We're all suffering from hypoxia because the pollution in the environment has decreased the oxygen availability in our body. Cancer cells love a low oxygen, sugary, toxic environment. Cellular terrain. How are your cells? What are they bathing in? Are they bathing in this wonderful, beautiful, nutritious fluid? Or are they bathing in toxic sump? Free radicals. Remember I talked about the mitochondria? All these toxins attack the mitochondria, and then it goes in overwhelm, and you have all these free radicals. Yes, we have wonderful, beautiful antioxidants to take care of them, but when our body is overwhelmed, we succumb to disease. And vaccines. I'll make a brief notion. Vaccines, you probably have read about that vaccines a long time ago, the polio virus was tainted with SM40 virus. So it is a possibility of causing illnesses, not to mention the additives that they put in there. Now, these are some of the things that we do. So when you come in to see me or my office, or anyone in my office, these are all the different treatment availability. And you can see it's a wide variety because cancer, as well as heart disease, as well as Alzheimer's, as well as any chronic illness, is a multifaceted problem. And there is not a magic bullet. There's lots of magic bullets. So we have to utilize, and I always kind of use the analogy that cancer is like having an earthquake in your body, and you've got to rebuild everything, and you need a team of people to rebuild it. So you heard about this quote before. The 5-year survivor rate, if you do conventional therapies, is about 2%. So statistics speak for themselves, and we know that this exists today, and we have to change the paradigm of what we're doing. It is happening slowly but surely. Right now as we speak, there's the Integrative Oncology Conference taking place. One of my staff is there, but it's taking place right now to change how medicine is being delivered to the patients. So as I talked about, a whole being platform. Again, I can't create war and attack your cancer, because cancer is a symptom of dis-ease and dysfunction in the body. So we have to address all of these things within the person, from their spirituality, mind, body, immunity, nourishment, detox, lifestyle, and then targeted cancer therapies. So diet, I'm not going to go into this. You have to eat food that has nutrients that help turn on your body and take care of itself. The biggest thing I always tell people, because there's lots of different discussion on what kind of diets are out there. Bottom line is, can't eat sugar. You cannot eat packaged foods and things that have sugar, like most everything has sugar, because if it's less than a certain percentage, it doesn't even have to be listed on the label. So you have to be careful about just reading labels. But you have to eat foods that are, as I said before, they are untouched by man and kissed by the sun. So what's your number? We've all talked about pH of our body. So the actual pH of our body is 7.43. And I'll never forget this and learning this, because I did rotation at the VA hospital in Chicago. And I was a student at the time, and we had to be trained to do what they call arterial blood gases. And we trained on these poor soldiers, and I say that because when you're practicing, you don't get it on the first time. You know, it usually takes many times. But we knew exactly the health of a patient based upon their pH. So if their pH went down, we knew exactly what we had to do to get them back in homeostasis. So yes, you can look at your urine, you can look in your saliva, but unfortunately, you have something called the tissue pH. And the tissue pH has to be alkaline for your body to work. Because if your body is acidic, basically the cell is paralyzed. It can't get oxygen, it can't get nutrients, it can't detoxify your immune system. So you wonder why you have your slew of illnesses, whether it's osteoporosis, heart disease, or cancer. It's because you have to keep your chemistry in balance. And we know this as scientists. We learn this in school. We learn this in basic biochemistry. And unfortunately, I think doctors, when they do a urinalysis, they look at it, and I always wonder, like, don't they see that the patient is acidic just in their urine alone? So, because the pH of your urine should be 7. So you have to get your body in an alkaline state. Now, supplements. These are not all the supplements I use. These are some of the top supplements that I use, because I personalize every single patient. And everybody patients here today, they know I do that. I do it based on what the patients need. Now, one of our laboratories does a sensitivity of your cancer cells, circulating tumor cells and stem cells that I spoke about earlier, and it tells me, okay, vitamin C and curcumin work great on this particular patient. It tells me specifically. Also, I do bioenergetic testing that tells me also what may or may not work on your cancer cells. Now, natural things. So that's why it is very important to use an array of supplements to help eradicate your illness. Insulin potentiation therapy. This is a therapy that has been around for over 50 years. It is utilizing insulin. And why insulin? Because cancer cells have insulin growth factors on them and insulin receptors, because Dr. Otto Warburg 80 years ago determined that cancer cells love sugar. So what we do to the patient is we give the patient insulin, we bring down their blood sugar to 40, and then we immediately give chemo, but our chemo is at a 10% dose, not 100%, but 10%. So the insulin acts as a Trojan horse to bring chemo into the cell. One other beautiful thing about insulin potentiation therapy, if patients need it, because I don't use it a lot, because most of the time I can utilize other things, is that when you bring the blood sugar down, the circulation goes up in the body. The body's blood becomes very, very alkaline. And what it does, it inactivates the enzymes that drive the cancer cell. So it has a wonderful, now what we do in our clinic, I don't know other clinics, before you get chemo, we give an array of about 6 to 8 natural substances to help. So like, I don't want your thyroid to go crazy, so I give a homeopathic for your thyroid. I give a homeopathic for your ovaries, a homeopathic for testes, depending on what the patient's needs. I give that first IV, and then I give the chemo, and then I give nutrients afterwards to preserve and decrease the production of free radicals and to preserve the body. This is the chemosensitivity test. So what we do is we send your blood, not a tissue sample, but your blood off to Greece, and it tells me all the chemo agents. There's about 49 chemo agents that are utilized all over the world, and it tells me exactly. So the lines that are very high tell me exactly what chemo agents specifically are going to work. And I will use a cocktail of chemo agents, some one day, some another day. It depends. It depends on how your test comes back. So it's very personalized. So pulsed electromagnetic field. This has been around for a while. There's over 1,000 PubMed studies. The Earth's magnetism has dropped tremendously. The cells resonate at an ideal hertz of about 60 hertz. If a cancer cell in your body was resonating at about 25 to 30. So our patients receive pulsed electromagnetic field. Now, we not only use this for cancer or the abnormal cells in your body, but we use it for pain, inflammation, oxygenation, and one of the most important things it does, it allows the membrane of every single cell in your body to work. So it is a magnificent treatment for every single person, for every single condition, and the studies are astoundingly impressive.